With post-surgical eyes, I'm seeing a lot more RK patients these days coming out of the woodwork, wanting things done to get them back to scratch. They rarely have a clean aura and CRF. Their waveform is a little bit shattered sometimes, but in general, I found it to be reassuring to see numbers still in the high 9s or 10 in a lot of these RK patients that I might have looked and not been comfortable doing their surgery in the past. And I think even more so, patients are coming in now from 2000, 2001. Some of them don't even have records. They're post-LASIK, 9 or 10 years, or they're post-PRK. It's extremely helpful in these settings to have corneal resistance factor numbers and know what you're dealing with. It's important to avoid the complication of having a patient comes in with a low CRF in the setting of a relatively normal corneal thickness. In a Pentacam or orb scan, it's not really helping you. In these patients, I don't mess around. I don't do corneal refractive surgery. But the reverse setting happens frequently enough, and it's reassuring to find a patient who has a solid CRF in the setting of a thin or cornea or irregular topography. And I'm going to show a couple case examples of these things. Again, I kind of liken it to tiptoeing through the minefield of refractive surgery with or without a metal detector, and I think the ocular response analysis can be that metal detector. Real quick, I'm just going to go over my parameters. I think everybody's maybe just a little different, but we probably all follow similar numbers here. Under 6.0 on the corneal resistance factor, they're just non-candidates for me. Low 6s, they've got to be, everything else has got to be spot on normal for me to consider a low myopic or hyperopic PRK. Otherwise, they're non-candidate for the past 2 to 2.5 diopters of treatment. High 6s to 7s, it's going to be PRK for me with the rare exception of a very thin subbowman's keratectomy. In a patient with high 7s with a low myopic prescription there. Corneal resistance factor 8 to 8.5, I'm basically looking at intralace, or femtosecond laser and PRK, and then above that I think you can do just about LASIK or intralace or PRK, I think is fine. But again, if you get a low waveform score, I think it needs to be repeated, and if it is repeatably low, you need to investigate that. I'm going to go over 3 cases real quick. I have a colleague who just recently referred a patient, basically for my opinion. He was wondering whether or not to do surgery on this patient who's had a lot done already. Hexagonal keratotomy back in '92, believe it or not. Then LASIK in 2000. He had no records. My colleague performed PRK in the left eye for a low hyperopic sphere, and he's got some astigmatism residual, and he says, hey, would an enhancement be advisable? The corneal thickness is okay. This is the right eye that he's not touching. But I think it's interesting to talk briefly about this right eye. It's been through a lot, obviously. It's got about 3 diopters of residual astigmatism here, 3.5 perhaps. So obviously the patient's not seeing terrifically out of this eye, but it's interesting to note pretty good waveform score over here in the high 7s, mid 7s. And corneal hysteresis and resistance factor is not bad, and it's relatively clean. So again, I think this speaks to the fact that, hey, if this patient was highly motivated to have the right eye surgery in this eye or PRK to smooth out that astigmatism, it certainly could be a conversation worth discussing. Here's the left eye, the one that my colleague was interested in. There's about a, again, there's a high mountain here, post-hyperopic treatment. But again, you've got relatively good corneal resistance factors, and I think that this patient could be touched up based on his corneal tissue properties. Now, second case here, I apologize, these are black and white, but essentially this patient was a patient who came in with, relatively normal corneal thickness, and some astigmatism, but only about 1.5 diopters to 2 diopters of astigmatism here. So normally, without the ocular response analysis, you might say, hey, this patient looks good. I'll go ahead and do LASIK. But I would caution against that based on the fact that you've got a fair amount of chatter here, and you've got a corneal resistance factor of 8 and hysteresis of 7. I'm looking at either femtosecond, thin flap femtosecond laser here or PRK. Again, same thing on this, this left eye. Third case here, and I don't have pennicamps to go with it, but I remember this case well, and actually Dave and I talked about this a while back. Patient with normal corneal thickness and essentially normal cornea, pardon me, not normal corneal thickness, but low corneal thickness, but normal cornea shape, and hysteresis and corneal resistance factor was excellent in this patient. This is a patient that, you know, may have been below your parameters to treat in terms of corneal thickness strictly, but you've got an opportunity to do surgery on this patient, in my opinion, and not lose this patient because of the ocular response analysis technology.